Hello, everyone. Today we'll talk again about healthy lifestyle, and with us is Dr. Daniela Farkas, is our special guest. Thank you, Dr. Farkas, for your time. Hello, and thank you.
Hello, and thank you for having me.
Today we'll talk about the connection between glycosylation and inflammation. And here's the first question because there is a very interesting topic. What do you think about this connection between glycosylation and inflammation? There's a connection between this.
Yes, there is a huge connection between glycosylation and aging or inflammation. What glycosylation is, the body attaches a molecule of sugar to protein and or a molecule of sugar to fat. So when you have this combination, like something that was fried in fat, like a piece of meat or a cookie, you have the ingredients that produce what we call glycosylation, where this chemical reaction takes place, where the body takes the sugar and attaches to, for example, fat. Uh, what this glycosylation does, it produces a low grade inflammation in the body. Uh, it is considered that the hallmark of any disease that exists in the body are uh, preceded by inflammation. And the more inflammation or glycosylation we have in the body, the worse we are. We know how to check, for example, a red blood cell, specifically hemoglobin, to see if it is glycosylated or not. And there is a test, it's called hemoglobin A1C, that checks the amount of glycosylation for the last 3 months, and it gives you a number. The higher the number, the more sugar you consume, more glycosylation you have. You want that number to be under 5. If it is over 6, you pretty much are what we call diabetic. So, yes, there is a huge connection between glycosylation and inflammation.
And what causes glucosylation?
So the glycosylation is caused by this reaction in the body because we do not know exactly how to eat properly. So we should not eat, for example, together at the same time protein with sugar or fat with sugar. If you eat fat, it's okay. Eat as much as you want, but not together with sugar. Because if you combine the two of them, chances are you are going to suffer the consequences, and there is not any way of stopping it. For example, when we cook a piece of meat, let's say a piece of chicken, if we fry it in the deep oil, it will have one effect on the body, and if you boil it, like on chicken soup, it will have a different uh, reaction on the body. It is the same piece of chicken, but the way we cook determine if it would be good for us or if it would not be good for us. So, yes,
Yeah.
there we go.
And uh, what is glycosylation? What it means for the body?
For the
It's
body, the more glycosylation an area has, the worse it is. For example, uh, if this reaction takes place where the glucose is attached to fat or the glucose is attached to protein, if this takes place and increases in the body, it usually forms like a type of cement that goes in the very small vessel. So the smaller the vessel, the more chances are to completely cut the circulation to that organ uh, from the rest of the cells or the rest of the tissue, rendering ineffective. The thinnest blood vessels we have in the body are in the eye, in the kidney, and in the distal part of the feet, like toes. That's why usually, you probably know, diabetic people are at risk of having kidney disease, having problems in the feet where we have to amputate, and having problems with the eye. So yes, this reaction is not innocent at all. It is pretty much a silent killer.
So glycosylation
Steroids.
affects our body very, very bad.
It is extremely bad because it's not only that we eat the bad food, but the time of consuming those food or the combination we consume them, it is extraordinarily important because, as I said, chicken could be consumed both ways, being fried or being boiled. It has extremely different consequences in the body.
Yeah. And how it affects aging, because we know all that we eat affects us.
Yes, glycosylation affects aging because it does inflame the underlying tissue. For example, the face. If we have uh, a lot of glycosylation going into the body, we pretty much cut the or decrease the circulation that goes to the face because we glycosylate or we put this coating almost, it feels like almost cement. And uh, since not enough of vascular supply comes to the face start to lose the luster, the elasticity, collagen tissue decreases, uh, and something called wrinkles comes. I don't know if you know that word.
Yeah, of
It's
course,
something I
all of
don't
us.
want to talk about, but it ages people unbelievable. Like sometimes I see people that have diabetes and they look 10, 20 years older than people that don't have diabetes. And it's not because they are unhealthy or this genetics, it's just because this reaction in the body is so detrimental for health.
There's a connection with the immune system. It's an autoimmune immune
Uh,
affection.
Anytime an inflammatory reaction uh, goes in the body, it will cause a reaction in the body where the body is going to know that something is not normal. And the more glycosylation goes, like for example, the more of those coated with sugar protein or glycosylation goes into a joint, it will cause a reaction, and the body is going to react as being a foreign body, and it will cause what we call an autoimmune response, and the body will try to protect the joint by killing the intruder, not realizing that it's only protein coated with sugar. And it's like in an army we would call this friendly fire.
Okay. And how can we avoid it? How we can how can we avoid the this
Glycosylation, this reaction.
this high
We could
always
avoid this relatively easy by trying to not consume sugar at the same time we consume meat, or not consume sugar at the same time we consume anything that has a lot of fat. This would be number one. But number two would be the way we cook our food. Like we take a piece of steak and we put it on very high temperature on the grill, and it is loaded with glycosylation agents. If we cook the same piece of meat on something that is a little lower temperature and longer time, the amount of glycosylation drops more than half. So it's not that I don't want people to eat meat or I don't want them to enjoy life at all. It's just that they should know that if they, for example, consume a nice piece of pastry that was fried in oil, is the combination, is the fat, is the carbohydrates, and on top of that, it's also the bad oil, which was probably reused for a couple of weeks, and it's all rancid, full of uh, uh, radicals and full of increased agents that produces what we call end stage glycosylation, or age uh, for short. There is another reaction in the body where the end stage glycosylation agents are transformed into rage, where is the end uh, end point where the glycosylation agents deposit into the joints or into the tissue, rendering it completely ineffective. This is also the reason many people have uh, a lot of inflammation, but only also a lot of senescent cells, or cells that are zombies, that are there only to occupy space and to use the resources that are allocated for the body, and produces nothing other than chemicals that further poisons the adjacent cells.
Yeah. Very interesting topic, this video, but we'll talk more about this in our future videos. Thank you for your time, Dr. Farkas, and
Thank you so
thank you all of you that you are watching us.
Thank you
Thank you.
so much.
Thank you.
Have a good one and take care.